This webinar was co-sponsored by Pain BC as well as the Canadian Pain Coalition. We're very glad to be working with both of those organizations to present this webinar. And also it was made possible partly through the support of the Direct Access Program with the BC government, so we're very grateful to them as well. We are going to have a question and answer portion at the end of Neil's presentation. My name is Tanya, and I work for the Canadian Institute for the Relief of Pain and Disability. And our presenter today is Neil Pearson. He is a clinical assistant professor at UBC, as well as a physiotherapist and a yoga therapist. He works exclusively with people with complex pain problems, and he's done various public education workshops with Pain BC, the Canadian Pain Coalition, the Arthritis Society, and then also now with us as well. And so we're really excited to have him here with us today. And one other person to mention is Anne Gillespie, who works with me at CIRPD. And she has done great work organizing this whole series. We have about 3 or 4 more webinars planned in the future, so I just wanted to give a shout out to her as well. Be collecting any questions that don't get answered during our question and answer time, and we'll post them as a blog post with answers to them, so that's something that you can look for. And I think that that is all that I have, so I'm going to hand it over to Neil for his presentation.
Great. Well, thank you very much, Tanya. I'd like to start by welcoming everyone and giving a big thank you to the Canadian Institute for Relief of Pain and Disability, to Pain BC, and to the Canadian Pain Coalition for sponsoring this. So as Tanya mentioned, if you do have any questions, you can type them out and send them in. We'll see how we can answer them. If it looks like it makes sense to answer them during the talk, then Tanya and Anna will let me know. Otherwise, we will look at them at the end. So really what I want to do with this presentation is you know, the headline is first slide is build hope. And really the idea around this, we look at the second slide here, is that we can change pain. So I've been a physiotherapist for about 26 years now and worked with people who are in trauma intensive cares, worked with preemie babies and full-term babies, and worked in multidisciplinary pain management centers and WCB sponsored clinics and private practice. And I've taught all across Canada all sorts of different healthcare professions, and it's really rare that you would hear anyone make a statement like this, that we can change pain. It's starting to change, and that the people are starting to recognize this now. And what I want to do today is explain to you what I mean by we can change pain, and show you some of the ideas of how we can do that. But to do this, what we need to do to start with is we need to shift our beliefs and our attitudes about pain. I'll explain more about that as we go along, but these are barriers. Our beliefs about pain, our attitudes towards pain are actually barriers to us moving forward. We also need to shift the beliefs about and attitudes towards people in pain. As many of us have experienced, the education of healthcare professionals sometimes becomes a barrier to our moving forward. So the statement at the bottom of the slide here says that less pain and living well are more about health than they are about medicine. Now, I don't want to give you the idea that medicine isn't involved in pain management, but I think what we need to do is use medicine for what it's really valuable for, but we also need to understand that to get better in the face of complex chronic pain problems, we need much more than medicine. We need really, to get around to, we need self-management. We need to teach you how to do that, and some strategies that will be very individual to you. Now, traditional views, we should look at those first. So where do we come from? Well, the traditional views around pain are that pain's a symptom telling you about damage of your body. That if you damage your body more, you'll get more pain, and if there's less pain, it means there's less damage to your body. And we've all experienced that this isn't really true. The best example would be if you stub your toe. I mean, you stub your toe, you can see stars, you can feel nauseated from the pain, yet the next day there's no bruise, there's no apparent damage at all. And there's so many experiences we get through this of this through life. You know, paper cuts are another one. And unfortunately, that view that the pain is only telling you about damage gives us the idea then, well, if we just fix the damage, the pain will go away. And working in pain management, we know that that's definitely not as it's too simple a view of the situation. The other traditional view is that there's nothing we can do about chronic pain. Typically when a person has chronic pain, you'll be provided with either medications, potential surgery or not. People teach you techniques to ignore it or distract you from it. Or you'll get the you just need to learn to live with it message, which is interesting because there's some truth in that, but it's not that you need to go on with the pain never changing. What we need to do is learn how to actually change it. And if that's the message, then it's actually a good message. Though sometimes it doesn't feel like that. Now, the traditional views about people with chronic pain, those of you with chronic pain know this well, is that if you have chronic pain, then the first thing that people think is, well, there must be a lot of damage in your body, or you must have some really nasty disease process. And then once the medical system has gone through and looked at that and they can't see that, then they often jump to things like this, where maybe the problem is you have a lower pain tolerance. Or sometimes people get well, it's a psychological problem that you have, or some sort of inherent flaw or weakness in your psyche. And then there's always the last one here, is that sometimes people view those who have chronic pain as someone who just doesn't want to go back to work, or who's malingering, or who's decided. I mean, to me, it's very odd ideas that we might view someone as deciding that they want to pretend that they have pain, because pretending that you have pain is not a great way of living your life. So it's just an odd thing that we would jump to that conclusion. And sometimes when I'm talking to people about this whole idea of malingering, I always mention to them the fact that people who are malingering don't kill themselves. Because the reality is that within chronic pain, the suicide rate is even higher than it is in chronic clinical depression. So there's traditional views about pain management as well. In terms of pain management, usually what you are provided with is medication or injections, which can definitely work, mostly temporarily, but they work. The other idea was that you need to learn to cope with the fact that you have pain 24 hours a day. Although the traditional coping strategies that we taught people didn't really help a lot of people. And then, strangely enough, when nothing else works, the last resort we were provided with is to send people to a pain management team, or a multidisciplinary pain management center, which is really, really odd, considering that the research says that the most effective way to deal with chronic pain problems is through multidisciplinary pain management centers, where they provide cognitive behavioral therapy as well as an exercise or activity component. So in terms of the current understanding of pain, our current understanding of pain is, as the slide shows, is that pain changes everything. Pain changes the chemistry within your body. It changes the way the cells function. It changes your tissues. It changes your system. So your respiratory system works in a different way. Your nervous system, your immune system, all these systems work differently. When you have pain, the way you breathe changes, your posture changes. It's hard to think when you have pain. Your emotions definitely change when you have pain. And you can see for each one of these things that this complex pain issue, this starts to affect every aspect of your existence. And of course that all sounds really, really horrid, and like if you have chronic pain, you understand this. And often when you look at this kind of a slide, it makes you think, like, how could you ever possibly get better? But the thing is that we can change, we have the ability to change each one of these things on this slide, and that's part of what we need to do to move people towards getting better. So also with the current understanding of pain, we know that pain is a complex and multifaceted problem. It's not as simple as you injured a disc and that's why you have back pain. It becomes much more complex. We know that persistent pain actually becomes a disease process in itself, where the pain itself changes systems of your body and starts to act like a disease. A current understanding of pain also says that pain is invisible. Now, if you've got chronic pain, you know this. No one knows if you do unless you communicate it to them. And because it's invisible, this is part of the reason why it's so hard to get good treatment. You know, you imagine the person who goes into the doctor well-dressed, made up, you know, not showing any big overt pain behaviors. Typically what they do is the person will get labeled as not having all that much pain just by their view. Which is sort of odd because they might have really horrible pain. Whereas another person who comes in may come in looking like, you know, they haven't shaved, their clothes are dirty, they don't smell like they've showered, they're holding their back a whole lot. And often, instead of saying, okay, this person obviously has a lot of pain, sometimes what happens is we label the person as you know, a drug seeker, or you know, it could be as bad as having a poor pain tolerance. Instead of saying, you know, here's obviously this is the impact that this pain can have on people. So if we go from understanding pain over to treatments, the research says, the research says in terms of the best treatment, I may have had you on the edge of your seat there thinking, what is the best treatment for people in chronic pain? Well, in scientific evidence says that the best treatment for people who have chronic pain is to combine cognitive behavioral therapies and some sort of progressive activity and exercise. The unfortunate thing is that even the best research shows that less than 50% of people get better with these programs. And one of the things I think that we need to understand when you see that low number is that the research can't modify treatment based on what's happening to the person. So you may have this person who's actually not getting better with treatment. In a clinical perspective, outside of a research project, what we do is we'd actually shift the treatment around to find a more effective way of helping them. Whereas in research, you can't do that. You have to just stick with what you're researching. And that's why there's probably a disparity between what we see clinically when we have the option of being able to change things around and what we see in this research. Yet still we know that when you combine these two things, activity and helping people with this cognitive behavioral therapy, it really, really can be effective. So we need to move from there. That's sort of where we are. And what we need to do is move forward with, so where do we go from here? Well, we want to try to come up with some innovative treatments for people in pain. I want to give you a little bit of what we're seeing around that. But generally, when we think about innovative treatments, we say that innovative treatments have to recognize that chronic pain conditions are closely related to nervous systems that are hypersensitive. So there's the central nervous system, the peripheral nervous system, and the autonomic nervous systems are all hypersensitive. These innovative treatments also need to understand that when you have a chronic pain problem, you have a problem in your body and you also have this problem in your nervous system. And so we need to treat both, whereas traditionally what we've done is gone after trying to fix the body. Or at other times we tried to just go after the psyche part of the nervous system, whereas we need to understand we need to treat all of these different things. Innovative treatments for people in chronic pain also take advantage of neuroplasticity. So you may have heard this in the media or read about it, but to understand neuroplasticity is basically what it means. So they take the word from plastic, and plastic is something that can be molded into any shape you want. It's just not easy to do. And so when we talk about neuroplasticity, we're saying that the nervous system can learn whatever it practices. Now, it's not going to be easy to change it, but the nervous system can pretty much learn anything that it practices over and over again, which means that if in the face of chronic pain your nervous system has changed, all these things in your body have changed, well, we can actually change that back. Now, we have to figure out how to do that, and there's lots of questions about it, but neuroplasticity has been in one person's book. A fellow named Norman Dodge wrote a book called The Brain That Changes Itself, which is a phenomenal book. It's the Brain That Changes Itself. And unfortunately, his chapter on pain is called the dark side of neuroplasticity. He says chronic pain is the dark side of neuroplasticity, meaning that in chronic pain your nervous system has changed in all these unfortunate ways. But the thing is, we're learning that we can change it back. So neuroplasticity says that pain can be changed, and that's good news. And I wanted to give you just some examples of this. So what's the evidence that pain can be changed? Well, here's pictures, each of these pictures are of a patient of mine. I've seen her for quite a number of years. She has a complex regional pain syndrome. And you can see the obvious changes that have happened in her foot, different changes in terms of swelling and color change and things in her right foot over time. Now, this is when her problem has been at its worst. And I also wanted to show you a picture of after this. This is a picture of her after when the condition actually improved. Now her condition has actually gotten better, so there's been times when her foot has looked more like this, there's been times when both her feet have looked more like this, and then there are times like this. I just saw her yesterday and she's been doing that stand-up paddle boarding this summer. Now it's sort of tough for her to do and it does give her some pain, but to me this is the best evidence that we see people with these really complex, very, very wound up nervous systems, and we see indications, times when they can get better. So other evidence around the fact the nervous system changed, if we look at the central nervous system, one of the things we know is it's trained learned helplessness. So learned helplessness is the idea that you can learn to feel helpless. And so what they've shown through research is that when people have chronic pain conditions, what happens is you stop trying to change the pain. I know that you would say, well, no, I never do stop trying to change the pain. But when we looked at the physiology of the body and the physiology of the brain, the parts of the brain that have to do with pain modulation start to shift over time in people who have chronic pain. And so they start to actually not be used as powerfully to try to change pains before. So the nervous system has actually been trained not to do it. And they've even been able to show this in people who don't have chronic pain. If you could just give anyone 3 or 4 episodes of uncontrolled pain, then the physiology of our body that normally would modulate or try to decrease that pain or inhibit it starts to change in a negative way. Of course, we know that the opposite is true as well, is that when a person's feeling powerless, feeling helpless in the face of things, if we can do things, we'll start to change their physiology back and change the person's belief that they can make changes. And of course, that's part of what I want to do today, is give you this idea that change is possible. Now, other evidence from the central nervous system, we know with the idea of imagery or visualization, is that, let me give you an example this way. Say someone has really bad rotator cuff tear and it really, really hurts to move their arm. What we can do is get them to visualize or imagine moving their arm, and when we do that, parts of the brain that are acting in this quite wound up way when the person actually moves their arm will still turn on when they think about it. But those parts of the brain turn on with sort of less power or less activity, and so this is less agitating. And so we can get people to actually practice moving their body by thinking about it. And when we practice moving the body without thinking about it, what will happen is it's almost like it desensitizes the nervous system. So then when the person starts to try to move their limb, there will be less pain when they do it. So it's actually changing the nervous system. Now it's not, I wish I had the time to go through it all for you, but this is can be quite difficult and may require some assistance from healthcare people. So we also know from other evidence that there's a thing called real-time functional MRI. So you probably know that an MRI is a picture of the inside of your body, whereas a functional MRI is a picture of how your brain works. Real-time functional MRI is when you're actually watching on a screen the changes in your brain activity over time. So if you can imagine a person laying inside of a MRI machine, and in front of them there's actually a screen. Above their head there's a screen, and they can see the activity of the brain. And then there's a researcher often in the control room, and he's got the same screen. And what he can do is he can circle parts of the brain on his screen, sort of like John Madden does on TV, and then it'll be circled on the screen in front of the person laying there. And through a microphone, he can circle that spot and he can say, I want you to try to turn down this activity of your brain. And what they found is that everyone who tried could actually do it. So really this is a biofeedback technique. But what they're really showing is that the alterations of brain activity, so in chronic pain there are some parts of your brain that are much more active than usual, in other areas of your brain that are less active than usual. And what they've actually been able to show with this research is that you can, if you've got feedback about what's happening there, you can change them just by thinking about it, which is I hope you can understand, really good news. So there's also lots of evidence around changing the autonomic nervous systems, these automatic nervous systems, the sympathetic and the parasympathetic nervous systems in your body. And there's, as it says here, growing evidence that things like yoga and meditation, tai chi, and some martial arts are actually really beneficial for people with chronic pain. Yoga is definitely coming out so far as the one that's the most researched and showing the most positive benefit. Meditation is showing benefits as well. I think yoga may show better benefits because of the physical body movement. Yoga has even been shown to be really beneficial in people who have fibromyalgia, which I'm sure most of you understand is a very, very complex problem of both chronic pain and fatigue. So we have also this other evidence from research that shows that your body image and your body schema can change, even in these complex regional pain syndromes. So a lot of people who have chronic pain, what happens is the mental map or the mental image that they have of their body gets distorted. So it may feel like it's bigger or smaller or numb, or some people feel like it's not there or it's not theirs. And what we've been able to show through research, not we, but the research has been able to show, is that if you can detect these sort of maladaptive body images and get the person to start to work on techniques that will bring that body image back to normal, when the body image comes back towards normal, the person's pain gets better as well. So once again, we can change it through that way. In terms of stress management, I always have a hard time knowing where to start with this one because it's so obvious that stress affects pain. But in terms of pain management, we haven't paid a lot of attention to it. Maybe give you an example. You can imagine that normally if you hear a knock on a door, it's not something that's going to cause any alarm. But you can imagine, say, if you woke up in the middle of the night, you've had a really, really bad dream about something, and you're feeling that sort of terror that the bad dream provided. If right at that point someone knocks at your door, the way your system responds is quite huge. And it's the same way around pain. So you've got some signals coming from your body. If your nervous system is in this wound up, stressed situation or state, you are going to feel much more pain from those signals from your body than you would in other times. So that says that what we really need to do is work on stress management with people. We can also change pains by changing input from the body. There's lots of research that shows that when people have these altered body schema or they don't feel their limb properly, either getting them to gently move that part of the body or touching that part of the body in different ways, or anything that gets input from that part of their body through their nervous system into their brain will start to change the body schema, and also will start to change the pain. So you can do this, get more information from your body to your brain by having someone touching that part of your body, by putting hot or cold or those things. You can do it by gently contracting the muscles. You can do it just by thinking about that part of your body. And you can do it with movement, as long as the movement isn't cranking up the pain a whole lot. So there's also evidence around this that we can change inputs from the body in terms of repetitive movements, that in the face of chronic pain, by doing repeated rhythmic movements, you can actually change the nervous system in a positive way and change neurochemistry, which will help to calm pain down. They've shown this with, strangely enough, with rhythmic walking, rhythmic breathing, and rhythmic gum chewing. All of these things are able to help your body release more serotonin, and with the increase in serotonin, we'd be able to actually have less pain. Now, of course, I'm a physical therapist and I'm a yoga therapist, so the idea of changing influence from the body, we have to talk about movement. And one of my colleagues is big on saying that motion is lotion. So the health of your cells, the cells themselves in your body and the tissues and the systems and everything about you is, things function more normally when your body is moving. Now, I'm not suggesting to you that in the face of chronic pain you just go out and you move regardless of what happens, but what we want to do is find a way to progressively increase the ability of you to move, because when you do that, that in itself will start to decrease your pain. But we get into these sort of two different approaches to activity. One of our approaches tends to be, well, I'm just going to suck it up and push on through, and then you sort of crash and burn from that, and that doesn't help the body adapt in a very good way. Or we get into the point of we learn that movement increases pain, so we just avoid the movement, and of course that's not going to work either. We need to find that middle road, and once again, this is where you really need a good healthcare professional to help you with finding the right amount of movement that's going to help with your physical body without just winding up your nervous system so much that you can't progress and move forward. But it is possible. That's the thing to know. So in terms of getting people from, if you look at the bottom of the screen here, that little circle down there that says pain, that's sort of where we are with complex pain. And up in the top right corner is where we want to get to. Sort of the three main goals, overarching goals of pain management are to have the person have less pain, better movements, and improve quality of life. And so we want to get you from the bottom to the top. Traditionally, what we've done is just said, well, you all need to follow this very specific linear path, but that's really not the way it works. When you have chronic pain, the first thing we need to do is provide you with some sort of knowledge about the way the pain system works, about pain biology. Now, for some people, they don't actually need to know how the pain system works, but if they don't know, at least their healthcare professional needs to know. And if a healthcare professional knows, then they'll be able to come up with some innovative ways of moving them forward. If they're stuck in the traditional views, it's really hard to move forward. And I think for everyone, the next step that we need to work on is getting into working on some sort of breathing technique, because breathing is the most powerful way to calm your nervous system down. We tend to use breathing as a distraction technique, but what we want to do in terms of breathing is get you to practice it at least 5 minutes at a time, at least 5 times a day. Work up towards being able to do that, and do that for at least 4 to 6 weeks before you're likely to see any really big improvements with it. But it's really, really important, because if you can't breathe when you're resting in your most comfortable position, there's no way you'll do it when you move. And if you don't breathe calmly when you move, then your nervous system is going to be wound up, and that movement's just going to be much more painful. So it's a really, really important thing to do for both stress management and for helping you with recovering function. So after that, what we need to do is practice. We need to practice things that are going to take the whole idea of neuroplasticity or use neuroplasticity. And so the things that we want to practice are these are 4 different things I think that are sort of common for everyone. Which one you do first or which one your patient does first is really up to their specific situation. But we need to regain awareness of our body, of our breath, of our thoughts and our emotions. And after awareness, we need to start to try to regulate them. We need to do things that will challenge our physical body, and we need to do things that will try to reset this wound-up nervous system to get it to be less sensitive and calmer. And the bottom circle there says goal setting. You can just take that as being planning. We need to have a plan. Anyone who succeeds in anything really difficult has a plan. And so whether you write it down or you have it inside you, you absolutely need to have a plan to move forward, because it's just, there's so much research that shows that that's a necessity. And if you don't know how to goal set, then what we need to do is find someone who can help you with goal setting around your pain management. So that's like a really quick run through a whole bunch of stuff that hopefully shows you the evidence is mounting that says that we can change pain. But I want to leave you with this idea that less pain and living well, which is where we want to get, requires, of the healthcare professional, requires this: an understanding of pain, an understanding of the lived experience of pain, and an understanding of health. I think if we put this in frame for the person with a complex chronic pain problem, less pain and living well requires possibly not an understanding of pain, but at least working with someone who has it. And the person needs to have the belief and the faith that the healthcare professional can actually help them with these innovative treatments. And then the big thing is persistence, because this neuroplasticity is not a quick thing. It takes a lot of practice to change the nervous system. It's absolutely possible to do it, but it's something that you just have to keep on working at and keep on working at. So, I know that was really fast, a lot of information, but hopefully it's giving you some hope, and I'm guessing there's probably some questions that have come on here. But I'll leave it to Tanya and Anne after I just give one last thank you to the CIRPD and the Canadian Pain Coalition and Pain BC for hosting this webinar.
Great. Thank you very much, Neil. That was wonderful. And there's definitely a lot of pieces within there that are very hopeful. Yes, wonderful. There were two questions that I noted for sure. One of them was someone was asking what kind of breathing you were referring to when you were talking about improved breathing.
Oh, that's a great yeah, great question. I wish I could tell you that there was one breathing technique that is the one that everyone needs to do. I don't believe that's so. It definitely doesn't seem to be clinically. However, what I can suggest to you is that when we are stressed or when we have chronic pain, what we tend to do is breathe more shallowly. We tend to, when we exhale, the exhale tends to be more forceful. And we tend to breathe using the muscles of our neck and our shoulders. And all of these things tend to promote winding up the nervous system, and I mean, they even change the pH of our blood. And so if you were to change your breathing to try to help with chronic pain, the words to think about are to make your breath longer. So not necessarily deeper, but definitely longer. And you want to make your breath calmer. And you want to make it rhythmic, because we know that rhythmic breathing is really helpful. So maybe breathing in. Well, the research would say that if you breathe in for between 4 to 6 seconds and breathe out for the same amount of time in this nice, calm way, breathing in through your nose and out through your nose, and that your belly is expanding as you breathe in, and when you breathe out, that's sort of the most calming, balancing way of breathing for most people. But if you have chronic pain and you start trying to breathe like that, you may find that you can't breathe in and out through your nose, and that's fine. Don't worry about it yet. You may find that you can't get your belly to expand as you breathe in, and if you can't, don't worry about that. And you may find that you cannot breathe in for 4 to 6 seconds, that all you can do to start with is maybe 2 or 2.5. And once again, that's fine. You start with what you can do by trying to make your breath a little bit longer than it has been, a little bit calmer than it has been. Try to relax the muscles around your neck and your shoulders and your jaw and your tongue. And then just over time, keep on working at it. And you may find that when you start, that all you can do is breathe calmly for maybe 5 or 6 breaths, and then you feel like you're out of breath. And that's just an indication of how far you need to go, or how far this pain has affected your breathing. And so it's the right thing to do, but it can take a long time to get there.
Neil, this is Anne here. One of the questions that did come up was about what combination of therapies was used for the patient with the CRPS.
Oh, I'm guessing my patient with feet. Wow, we have used almost everything. We've used very specific mirror box treatments. We've used imagery, lots of different breathing and stress management techniques. And the first summer that she was able to regain the ability to be back up on her water skis and wakeboard, one of the therapies she had was she actually was at St. Paul's in Vancouver, and they implanted a spinal cord stimulator in her back. Now the spinal cord stimulator was helpful, but it was all the other techniques that she was doing that sort of got her back up water skiing again.
Okay. I have to ask this one because you did mention even gum chewing could contribute. Right. Is that a good place to start?
Well, actually, that's a great question since I mentioned it. So I contacted the researchers after I read their 3 different studies, one that showed gum chewing, one that showed breathing, and one that showed rhythmic walking all helped with releasing serotonin. And I asked them whether they had noticed when people rhythmically gum chew. So this is gum chewing to the rhythm of a metronome, right? Which isn't the way most of us gum chew. But anyway, so I asked them whether when people did that, whether they started to breathe rhythmically, and they just got back to me and said that they hadn't paid any attention to that, which is sort of too bad because I'm guessing that that's part of the reason why it works. I know that with rhythmic walking, if you walk rhythmically, you must breathe rhythmically, just because of the mechanism of our breathing. So there's a good chance that it's the rhythmic movement of your jaw, as well as the fact that you probably breathe rhythmically when you do it. The two of them combined are probably what's giving the powerful effect.
Mm-hmm. This may be a common question that a lot of people who have endured chronic pain for years may have, and that's that some of it's not diagnosed. And one person in particular is saying that they have been on a wait list for St. Paul's Clinic for about 5 years.
Wow.
And do you know of any groups, other ways to get into a pain clinic?
Other ways to get into a pain clinic. Wow. I mean, it really depends on, one of the biggest things, it depends on funding. St. Paul's is one of the very few publicly funded clinics. There are a number of other clinics that can be funded by other insurance companies, anywhere from, so there's a few in Calgary, there's a few in Vancouver. I'm trying to think of where. I mean, one of the things that access is such a huge problem. Access to this thing. Which is just on that note, both the Canadian Pain Coalition and Pain BC are working on trying to find ways to get the government to change around this access. But I wish I could tell you there's an easy solution, and I wish I could tell you that there's a lot of people out there outside of the pain management centers that know this information and work with it. But there's just not a lot. We're just sort of starting to change people's education and their treatment techniques.
Mm-hmm. A couple of questions around yoga, and is there a particular kind of yoga that is best for people with chronic pain, and do you know how to identify good sources for programs?
Okay, so to the first part of the question is there a particular kind? I would have to say no from my experience. I typically would suggest to people to go to more gentle yogas. However, recently I've talked with two people who had really quite severe fibromyalgia, and they both went to Ashtanga yoga, which is a very energetic, gymnastic type of yoga, and that was the answer for both of them, which I find sort of surprising. The research typically around this, they look to, or the research studies have used Iyengar yoga, which is a great technique to use. It really helps to make sure the body's in good alignment, that you aren't stressing the body while you do it. And then there's been other research that's looked more at yoga that's been less physically based and been more based on body awareness, breathing, and the meditative aspects of yoga, and found that those are really helpful as well. So in terms of how do you know, I don't know what yoga to tell you to go to. I think the best thing you need to do is to be a consumer. If you're interested in yoga, find yoga teachers in your area and talk to them. Tell them what's happening with you. See if they'll listen. If they'll listen, there's number one. Okay, they might actually be someone who can help you. And then if you're going to get the idea whether they have any interest in chronic pain, or some yoga teachers are much more interested in working on the non-therapeutic side of it. So you really just need to go and talk with the teacher to find what is their interest and doesn't seem like it will work for you. And besides that, I don't know how else to tell you. Yeah, because in yoga we would say that this idea is that yoga is the science of one. So yoga is the science of one, and that means that what we want to do in yoga is we take as much of a scientific view of helping a person as possible, but what we do is we give them what we think would make sense, and then watch to see how it affects the person, listen for what they say about how it's affecting them, and then modify it based on what's happening to the individual in front of us, and with our understanding that change takes time. And so what particular kind of yoga is going to be best for you is not necessarily what's going to be best for someone else. Some people even would say that their way through chronic pain is to do karma yoga, which is volunteering and self-service. Other people might say it's bhakti yoga, which is through devotion and love, which would take too much time to fully explain it, but it's just a different way to find an answer. And really, I think what yoga says is there's not one path. We have to find the path that's right for us.
Great answer. I could see we could do a whole other session on yoga. with the video, of course. I don't know if we have time for one more question. There's a lot of other questions that we will, as Tanya mentioned, put up on the blog. And if there's any, Neil, that might require your input, we'll try and get that as well.
No problem.
That's great. Thank you. So maybe if there is time, you could just answer this one. Could you talk about the mirror box?
Okay. So before we leave the yoga thing, I just want to do a little bit of shameless self-promotion, and that I've started up doing some yoga retreats for people who have chronic pain. And so if anyone's interested in that, just have a look at my website. I'm doing one at the end of September in Naramata, which is just north of Penticton, and also have a very basic, gentle DVD for helping people with chronic pain through yoga. So if we go to the mirror box, the basic idea of a mirror box is that when your brain sees your body moving without it causing you any discomfort, then that will change the way your nervous system works. So if you can imagine a person who has really bad pain in their left hand, and they look at their left hand and they move it, and when they move it they see it moving and it hurts a lot. So imagine if you got the person to sit with their left hand hidden, and then their right hand is, actually imagine they're sitting at a table, and on the table in front of them is a mirror, and the mirror is facing towards the right hand. The mirror face is facing towards the right hand. And they place their right hand on the table, and they look in the mirror, and so they can see their right hand and the reflection of their left hand. And then they can put their left hand behind the mirror so they can't actually see it. But what they're looking down now is they know they're seeing their right hand and the reflection of their right hand, but to their brain it looks like the left hand. And so if you get the person to start to move their right hand and look in the mirror, they're now seeing both their right and their left hand moving without pain. And what actually Dr. Ramachandran, a fellow doctor from India, started to notice is that you could use this for helping people with phantom hand pain after amputations. And then what we've been able to see is that when people have really complex, severe pain in one side of their body, if you can get them to watch a mirror image of the other side of their body moving without pain, and often this will actually start to decrease the pain. It's as if the brain has learned that whenever that part of the body moves, it's going to hurt. But if it sees that part of the body moving over and over and over again without hurt, then it's almost like it convinces the brain that it was coming to the wrong conclusion, and so it allows you to move with less pain, which I know sounds so science fiction-like, but it's not a whole lot different than if an Olympic high jumper was looking at a high bar, and he's looking at it and he's playing the little movie in his brain over and over and over again that he's going to hit the bar. You know that his likelihood of hitting that bar is way higher than if you played the movie of him, watching himself in his mind getting over. The likelihood of him getting over is higher. It doesn't mean that he will. It's just the likelihood is higher. And so it's changing the way the nervous system is viewing the body, and then this in turn will change the way the nervous system interprets the sensation of movement. For the high jumper, it allows him to jump higher. For the person in pain, it allows you to move more with less pain. There's a website by it's www.noigroup.com. What was I said? I can't remember now if it's .com or .org. Anyway, it's noigroup.com or noigroup.org, and they actually have a place on their website where you can go through this hand laterality and mirror work guided through the website, because they are the ones who've done most of the research to it. But if you think that would be helpful, you can go on YouTube and put in mirror box and see things about it as well. But it can be really, really helpful as part of a treatment for people who have pain.
That's very, very good. I did just check, and it's noigroup.com, just for people. So I think we're going to have to wrap it up. Our time is about done, but thank you so much, Neil. That was really wonderful, and great answering the questions, and that was really fantastic. I also want to thank everyone for joining us today. If you're looking for further information in the meantime, you can check out any of the websites of Neil at lifeisnow.ca or CIRPD.org or the Canadian Pain Coalition or Pain BC. You can get much more information on a lot of these issues on all of those sites. Thank you very much, everyone, for being here.